Welcome to Fertility Unfiltered, where we dive deep into the world of fertility, debunk myths, and tackle the questions you have always wanted to ask but never dared. I'm Dr. Lo Chai Ling, your host, and today we have an extraordinary guest who is a true pioneer in the field of obstetrics and gynaecology. Joining us is Dr. Anupriya Agarwal, a seasoned obstetrician and gynaecologist and an IVF clinician with over 25 years under her belt. She's a master of complex gynae surgery, advanced laparoscopic and hysteroscopic procedures, and she's navigated the intricate waters of IVF and high-risk obstetrics with finesse. Dr. Agarwal is the trailblazer who performed Asia's first ovarian tissue cryopreservation and reimplantation, leading to the birth of 2 healthy babies. Impressive, right? Today, we're peeling back the layers of egg freezing and IVF, the hot topics everyone's curious about but too shy to discuss. Get ready for some straight talk and expert insights. So nice to have you. I've always been very excited about this topic. I myself have wondered about egg freezing. So what sort of women actually go to see you for such procedures?
Well, there are a wide variety of working women who are coming forward to buy this fertility insurance, they call it these days. Most of them are working women. A lot of them are coming from the tech side, and that's more because tech companies are offering more incentives, or they are subsidizing that cost. But it could be anybody. I recently had a cabin crew, I've had doctors, colleagues who have come and done it. So right. Yeah, basically anybody who's wanting to buy some more time before they find Mr. Almost Right.
So what are the age, what is the common age group that you see?
Most women 20s, will come,
30s.
I tell you very specifically, around 35.
Because, oh really? That's when you realize Mr. Right is not coming.
Yes. Common media has made sure that most women are aware now that 35 is when fertility begins to slide. Yeah. So that's when the alarm bells ding, 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 ding start ringing. And that's when women, if they haven't found the guy, they will try and come in.
So it isn't just women that have health issues that may be going for some treatment that may affect the fertility. Actually, this is a treatment that all women...
Yeah, all women who are not ready for motherhood just yet, they can come and they can do it. If they have a partner, married, they do embryo freezing. If they don't, then they can do egg freezing.
I see. Okay. And is there an age limit? Like, who's too old?
Well, in Singapore, we can't do it beyond 37 years. Okay. So after your 38th birthday, you cannot do it.
Okay.
Generally in the world, you can freeze it at any time for medical, and this is for social egg freezing, which means there is no medical problem. We are just doing it because the patient so wants. For medical egg freezing, there is no age limit. But in the scheme of fertility, the sooner, the better.
Okay.
So ideally, between the ages of 32 to 37 is the best time, because if you do it too early, most likely you will not need it. Because your fertility is still so good, you will not be needing those eggs. And if you do it too late, then you will get too few and too poor quality eggs. So
okay. So there is just the right time.
That right window is 32 to 37.
So how long can I, if I wanted to freeze my eggs, how long could the eggs be frozen for before I have to, use them?
There is no limit as such.
Okay.
You can freeze them for years.
Right. Yeah. So they remain viable as long as they are kept.
Now the technology is such that you can use it years, 20, 30 years later also. But we recommend women use it before they turn 45. After 45, to be pregnant, and there may be a lot of underlying medical problems that start developing by then. So all those things are...
So do people, after they freeze their eggs and it gets fertilized, do they actually carry the pregnancy themselves, or do they use a surrogate?
In Singapore, surrogacy is not allowed. Okay. So yes, they have to be legally married by the time they want to use those eggs. They have to be legally married. IVF needs to be done, so these eggs will be thawed and fertilized in the laboratory, and then the resulting embryos will then be implanted inside.
So
woman.
in Singapore, we can only, once we freeze the eggs, we can only use it if we get married. We sort of can't get a handsome boyfriend to fertilize our eggs.
You can't, not in Singapore.
Not in Singapore. So you actually need, okay. And what are the risks involved with such procedures?
These days, there are minimal risks. IVF has really evolved. We have very safe protocols in which we can stimulate it such that there is minimal risk to the patient. Previously, there used to be a condition called ovarian hyperstimulation syndrome, in which the person, the patient, she over-responds to the medications that we give, and that is usually seen in the younger patients, in patients who have polycystic ovarian syndrome.
Okay.
But now we have protocols that even in such patients, we can use those kind of protocols, those kind of medications, and with that, we hardly ever see severe hyperstimulation anymore.
Oh, you won't believe it. I think maybe a lot of my patients haven't met Mr. Right yet, because they are actually asking me questions about egg freezing. So run me through, how does it work? If, you know, I were to think of freezing my eggs, how long is this procedure going to take? What would I have to do?
We realize that women are quite busy. These are very successful, busy women. So we try to make it very simple. There is usually one consult. Whenever they call in, we'll give a consult. My girls have become quite smart now, so they will try to bring them on the days that I want to do the blood test, which is usually cycle day 2 to 4 of her period. So if today her period start, then tomorrow or the next couple of days we can do the test.
Okay.
So that is the time I do the consult. We do ultrasound scan as well as blood test, just to exclude any other problems and assess her hormones, which will help us see what kind of medication, or what kind of protocol is suitable for her. And then we have a follow-up visit. Then, depending on when her schedule allows, we start the stimulation. The stimulation involves taking injections for a period of about 10 days.
Okay.
And some days there will be 2 or more injections.
And she will have to self-administer?
It is all self-administered. Most of the medications that we use are coming in the form of pens. So you basically just dial and inject. It's very, very simple now.
Okay.
So they do that.
Subcutaneous injection.
Subcutaneous, just
easy.
Yeah.
Okay.
Very simple. And then during this time, she has to come between 3 to 4 times in that IVF stimulation cycle for an ultrasound scan, during which we will assess her response, and if required, we tweak the dosage. For majority, more than 80% of the patients, we don't need to do anything.
I see.
And then there will be a final trigger shot, and about 36 hours later is when we do the egg collection. The egg collection is done under anesthesia, and it is done at one of the IVF centers. So either Mount Elizabeth or Novena, usually I work with those. And it is a simple procedure. It takes about 20 to 30 minutes to do that, depending on how many eggs are there. It is done through the vagina, so there's no cut on the tummy. And there's a short recovery period. Total stay, I would say 3 to 4 hours, and then she's back home. That night they have a little bit of cramping. Usually we give them medications to help with that. And that's it.
So it's just a one time, and how many eggs would be harvested each time?
We aim to do whatever we safely can, which means whatever we can do to avoid ovarian hyperstimulation. We of course don't want too many eggs, we don't want too few eggs. So based on her hormonal profile, based on the ultrasound scan findings, we go and assess what is the best dose, aiming for, if we can, upwards of between 15 to 20 eggs is what I aim for, because that is safe and it is a good number to give her a reasonable chance, even if she just wants to do one cycle of egg stimulation and egg freezing. It gives her a reasonable chance for at least one baby.
Okay. So that is why, I mean, I have so many questions. That is so interesting. It means that the woman just has to be in Singapore for about 2 weeks, right?
That's it.
That's it. And during this time when she's self-injecting, is there anything that she needs to avoid or can't do? She has to avoid alcohol or maybe vigorous exercise, that sort of thing?
So, I mean, alcohol is not the best. The occasional glass of wine, we say it's okay.
Yeah.
But vigorous exercise, yes. So from day 5 of stimulation until she gets her period, which usually happens about a week or 10 days after the egg collection, we tell them to not do vigorous exercise. They can walk, but they can cycle, but no tumbling exercises. This is because the ovaries are usually quite big. These ovaries are 6-7 centimeters or more in diameter, and these ovaries can sometimes twist, and that becomes a surgical emergency. So we always tell them that you can continue doing the regular stuff till say day 5 or 6 of stimulation, but after that and until the next period comes, you have to
because of the hormones we inject, the ovaries are actually bigger than it would be in our normal menstrual cycle.
Yes, because normal menstrual cycle there is only one egg that develops, but this time we are aiming for say 15 to 20. So the ovaries actually, they look like a bunch of grapes on both the sides. So they are quite big.
So how long will it take for the ovaries to recover and go back to normal activity?
Once the next period comes, everything. Each cycle is like a blank slate, so the body just erases off everything. So
and are there any side effects of these injections? Are they worried about weight gain, acne, hair loss?
Unfortunately, yes. It's a short period, but most women, the most common symptom that they say is fatigue. They feel very, very exhausted because, and I tell them, look, your body is busy doing something that is taking up so much of resources that you will feel very tired. So moodiness is the other one. Those that have boyfriends or partners, then I usually invite the partner and tell them that this is your job to make sure that she is, calm, that you be the calming person in the life. Don't aggravate her. She doesn't like something, just don't do it, kind of thing.
Just buy her the handbag.
That's right.
So it's almost like a very bad PMS, sort of like.
Yes, because the hormones are pretty similar to that. Some will complain of headache, some have a little bit of nausea, but fatigue and low mood or very volatile mood is usually what we expect. And there's a lot of emotion as well, right? I tell them it's not just a money or a time investment, it's an emotional investment. You want this so badly, you want to see how you did. It's almost like a report card, like you're giving an exam and then you know how many eggs you got.
And like you said, rightly so, it's almost like insurance for a lot of girls. And maybe a lot of them doing this will not have boyfriends even,
some of them, they don't have boyfriends. And in fact, you're right, majority do not have boyfriends. They don't have any partners.
So what's the most common reason somebody would go for egg freezing, you think?
Career?
They
say that they are really riding the wave and they don't want to interrupt anything. It's like a surf wave. They say, oh, I'm just doing so well, promotion after promotion, and why should I just give it up right now?
So, that brings back to our point that women always loggerheads, right, between family and work, and it's always a trade-off. So with this option, it almost gives us the option of having it all, right?
Yes, absolutely. But I tell my patients, say, don't stretch it too much. By the time you're 40, 45, you don't know what new medical problems come into you. And then it might just be, you think you have it all covered. And if you're having that 1 or 2 very precious pregnancy, you really want to enjoy that pregnancy. You want to be able to eat everything. You want to be able to exercise. You want to be able to, have fun in that pregnancy, because not be on bed rest or be on restricted activities and cannot eat this because you have diabetes and cannot eat salty food because you have hypertension. So what fun is that then?
Because while you may have harvested these eggs while they are younger, so they are healthy and viable, if you have a late pregnancy as an implanted in your 40s, you still have all the risk of late pregnancy.
I mean, to be honest, the ideal age for fertility is in the 20s. But I have a 22 and a 19-year-old child. I mean, I would not imagine even for the next maybe 8 to 10 years for them to even consider.
Yes.
And both of them have a boyfriend and girlfriend. I have a boy and a girl. And I'm like, just the thought of these kids wanting to reproduce just gives me the heebie-jeebies. So, yeah, I mean, unfortunately, that is the peak fertility. But these days, I had my first kid at 29. My mother had me when she was 19.
Oh.
I had mine when first child at 29.
Yes.
And I see a lot of women these days, 37, 39,
Yeah.
that's when they have
is
their
already
first
considered
child.
young,
Yeah.
right?
Yeah.
In those days.
Yeah.
So who's the youngest you've seen amongst your patients that have come for
egg freezing? Yeah, maybe around 31 years old.
Okay.
Yeah, they are the ones that come.
And you just have to do it once. Do people repeat this
Yes,
procedure?
so it depends on how many and what is the quality of the eggs
Yeah.
that we get. The older patients especially, they do need to repeat it. It also depends on how many babies you are hoping to have.
Okay.
So if say you want, and there's a very cool online tools which can help you calculate. So you have all these graphs.
really?
That, yeah, if you have 10 eggs, then you have a 70%. Then depending on which
Okay.
age you are,
Yeah.
you have a 70% chance of having one baby, maybe a 50% chance of having 2 babies, and only a 10% chance of having 3 babies. So something
I
like that.
see. Okay.
And with each age, of course, it keeps going down and down. When patients come, I have this kind of a leaflet prepared, which has all these various things that you have discussed. All those things are written there, so they can take
Yeah.
their time and mull over it, decide peacefully, and then make
okay.
a informed decision.
So this is all social egg freezing. How about the medical ones? What are the common medical problems people will have?
So mostly it's cancer. So young women, they have cancer, and our cancer colleagues have become so good at their job that previously these patients would not be able to survive into the reproductive age. So that thought of fertility preservation never arose. But since our colleagues have become so good at treating cancer and the disease kind of goes away, then these people, this cancer survivors, they want to have a wholesome life, of course, and that for most people would include reproduction.
Okay.
So cancer would be the most important one.
Yeah.
And then there would be other conditions, some autoimmune conditions, which also require medications that are quite similar to cancer medications or other medications which will permanently affect their ovarian reserve. So it will just kill
so
the
they'll
eggs
freeze
inside
the eggs and then go for the treatment. And then hopefully come
recover, and then we can use these eggs, fertilize them.
That's interesting.
Yeah.
So say this scenario, imagine I'm single, I've frozen my eggs, and even after 10 years I haven't found the ideal man. So what happens to my eggs?
I mean, you'll have to continue there's an annual or a 3-yearly
So I have to pay the
renewal.
money.
You have to keep renewing until the time that you
Can I have a donor sperm, sort of fertilize it?
In Singapore, that's not allowed.
Okay.
But yes, technically that it is feasible. So say for a foreign patient, she freezes the eggs here, and then a few years later she relocates back to her home country. She can transfer these frozen eggs in the frozen condition back to wherever she wants
Find
to.
a Ryan Gosling
then,
to...
Yeah, that's right.
Okay.
Yes. Get the best one.
That's the ideal plan. But ultimately, we don't use these eggs. Do we donate them?
You technically
destroy
can,
them?
yes. So you technically can donate them, but there are a lot of legal implications. You need to be ready for that. So you can possibly donate them. See, in Singapore, it is still pretty new. It's just been about a year. So it will take a while before we get to that point when women decide, that, oh, I don't think I'm going to be using these eggs.
Okay.
So we'll see how that goes. But yes, egg donation is a possibility. There are certain other countries in the world where they actually run egg banks. So you can can possibly I hope to see in the future that there's an egg bank, because women, there are so many who have medical conditions like endometriosis or other problems that make them have very, very low ovarian reserve,
Yes.
which means we cannot harvest their own eggs, but they really, really want to become a mother, and so we can get the eggs from the egg bank and fertilize with their partner's sperm, make a baby and implant it inside the
So
uterus.
these are not options in Singapore right now, but in other parts of the world, these are the options. So to be clear, in Singapore, unless we marry a Ryan Gosling, we can't have Ryan Gosling fertilizing our eggs.
That's right.
So say I've married a Ryan Gosling and, you know, he has sort of fertilized my eggs. So what are the next steps? So then it's implanted, and then if it's how many eggs would be implanted, and
so we have become more efficient. We have become better in the lab. So while government allows us to put back 2, for maybe 95% of my patients, I recommend putting in 1 at a time. Our wombs are designed to house 1 baby at one time. So if you have 2 or more, then there is a higher probability of problems, like premature. So twins, triplets, they have a higher probability of complications, premature labor, miscarriage, higher medical problems, hypertension, diabetes, so many pregnancy complications. So we try to convince women to put 1 embryo at one time.
I see. But that would also reduce the chances of success, would you say? If you're putting
it also depends on the quality of the embryos that we have. So if the quality is top quality, we have a very high chance of it implanting. Of course, if we get 2, there will be a higher chance of implant. So for example, the implantation of a top quality single embryo transfer, you put only 1 embryo, but it's of the best quality, is about 40%.
How would you tell it's top quality though?
The embryologists are the ones who will see that. It depends. Each of the embryo these days is put in a what we call as a time-lapse machine. So it is exactly that. It is a time-lapse machine. So embryos are put inside a box, but there is a camera. This camera is clicking pictures every few hours. So we are able to see how this embryo is developing, and there are set and known milestones and benchmarks for how many hours after it will be, how many cells, and etc., and how these cells should be looking, and how the embryo itself should be looking. So based on that whole journey, we are able to, with time-lapse these days, most good labs have time-lapse machines, and with time-lapse they are able to tell which are the good quality embryos. And morphologically also, a good quality embryo has certain like features. It's just like you can see, you know, some people are beautiful, some embryos are beautiful, and now we look at it and say, oh, this is such a beautiful embryo. And of course, the patients seem to think we are cuckoo, but we know that this one has potential.
But also the maternal age, does it make a difference in terms of receiving the embryo and success rates?
The main determinant is the egg quality. So we have now experience of many, many decades whereby we are doing donor egg cycles in which we get eggs from a younger woman and we fertilize it with a partner sperm and we put it inside an older woman's womb, and the success rate of those cycles is very, very high.
So the main factor for embryo quality is really the age of the egg. How about the age of the sperm? What happens?
Not so important.
Oh, so a young woman can be fertilized by old sperm, it's Oh, right, So the woman actually makes a is a very important factor.
Of course, she's the biggest factor.
So, in your opinion, you prefer to implant it 1 at a time. And what kind of success rates are we looking at? Just a range, so that you know.
Well, it depends on what age these eggs were harvested. For say somebody who is less than 32 years, maybe even an 80% success rate. But somebody who's 40 plus, maybe only a 15%.
So harvesting the eggs when you're early and paying for the storage fees is actually maybe a better insurance than harvesting it late. Whether or not the age of the sperm is older or younger.
Absolutely.
Absolutely. So say after I have the egg implanted in me, is there any difference with the normal pregnancy that I have to take care of? Because this is sort of like not a natural.
Artificial. Yes. So for the first 2 to 3 months, that is the critical period.
Okay.
So I tell my patients, it's like you sowed a seed, right?
Yeah.
Now you have to protect it. You can't let the big winds and the big water come on it.
Yes.
So you have to protect it for the first few weeks, and after 12 weeks of pregnancy, so the day the pregnancy is confirmed is already 4 weeks.
Okay.
So another 2 months after, that's the most critical time.
Okay.
And once that passes, then we stop all the hormonal support medications. During that time, we usually give a lot of hormonal support medications, a lot of supplements.
Are they injections or oral?
Mostly oral and vaginal.
Oh, vaginal, okay.
So
and
we
bed
do
rest?
No.
Complete bed, no bed rest.
No bed rest. These days, no bed rest. Only on the days or for a few days after, if she has bleeding, which is not uncommon in women who conceive using assisted reproduction. We see a lot of women have some bleeding, spotting, brownish discharge, something like that. So for a few days after that, say a week or so, we tell them restricted activities, no sex, but otherwise the life goes on as normal. They can walk, they can do gentle swimming.
No vigorous exercise, just be a little bit more careful.
That's right.
And buy her all the handbags she wants.
Yes, that's right. That's the mental is very important, so keep her happy.
Yeah. So how does this contrast with IVF? Say a couple comes in and they have difficulty conceiving. You know, how is the process different?
So the process is pretty much the same. It's just that for IVF, we will harvest the eggs, and at the same time, those fresh eggs are fertilized with the husband's sperm, and then we make an embryo and we freeze it. Okay. Now, the human egg is a very big cell, and it has what we call as a spindle. So that, which is basically the chromosomes, the genes. So that makes it a very difficult egg to freeze, because if there are ice crystals, and which is why for many years egg freezing had very dismal results, and that's why it was not pursued, because a lot of these eggs, when we froze them, there would be crystal formation inside, and when we thought that crystal would break the spindle or damage the spindle, and that damage would basically make that egg not be able to get fertilized. So then it didn't work out. But now we use a special type of freezing method called vitrification. So vitrification basically makes or prevents crystal formation. It jellifies the inside of the sperm. So it's just jelly. It's not crystal. So then the spindle is intact.
So that revolutionized the world of egg freezing.
Correct.
Making it
so first we use it for embryos, and when we got a lot more success with embryos, and we saw that compared to previously with the old slow freezing, as we call it, that resulted in about a 70-80% chance of embryos that were frozen surviving. Now we had close to 100% chance of these embryos surviving. So then it slowly went, and as the embryologists became better and better at it, so then they took it to the next step, which is freezing eggs, which is like the holy grail if you could do eggs well. And most embryologists these days, they are quite competent, they are quite comfortable with vitrification. It's a very fast moving technique, but they have enough experience having done it for embryos for so many years that now they are able to do it for the
So
eggs.
this egg freezing, how long has it been in Singapore?
Since last year. It has been allowed since last year.
Okay. So
July
you've seen a lot of inquiries since last
We
year?
have done a lot of cycles. We've seen a lot of interest. Mostly, when I ask them, so how did you find out about us? Then they'll say, oh, my friend did it. And so usually it's like that. And I'm hoping that as people get more and more confident, they are going through more cycles, their friends, their girlfriends are seeing that, oh, it's not a very onerous thing. It's not like you are down and out and whatever. More and more girls will want to use this as a fertility insurance for themselves.
Okay. I mean, that's interesting. So imagine I have frozen my eggs. Can I do gender selection, that sort of thing?
The technology for that, yes, it exists. But in Singapore, again, it's not legal to do that. Yeah.
So I can't choose my gender.
Yes.
But in terms of screening for all the diseases, it is as per normal once embryo is implanted, or do we actually screen for diseases when it's in the egg form? Is that possible?
No, it's not. So disease screening, we can do carrier screening for her and carrier screening for both the partners. That's like a blood test that will, there are different panels, the 4 common ones up all the way up to even 200 common genes which can be tested. So, I mean, I don't do it as a routine, but that technology is available. I do mention in the passing if someone or I take family history. If someone has a strong family history of genetic diseases in the family, then they are quite interested in doing it. So, and it's not super expensive. I think it's just over $1,000. So we can, it is not like hundreds of thousands of dollars or very, very expensive test that you can't do it. So that test can be done on the partners. For the embryo itself, again, technology exists, but in Singapore, and that technology is called reimplantation genetic screening, which means we make the egg and the sperm fertilize, they make an embryo, and a little part of an embryo, a biopsy is taken from there, and that can be tested to see, not for everything under the sun, but for common things. So that technology definitely exists. If there are known problems, say someone has a thalassemia carrier, both partners are thalassemia carriers, or if one of the partners is Huntington's chorea or some other genetic problem, then it is allowed in Singapore. If you have a genetic problem, we can do a genetic diagnosis on that embryo and make sure that we transfer only those embryos that are not affected. But if there is no abnormality, then you can't just do a selection. Even though the technology is the same, it's not legally allowed in
I understand. So we cannot make designer babies, but we can prevent.
Not in Singapore.
Not in Singapore. Okay, so how much is this going to set me back? Because, you know, if I'm a young lady, cost may be an issue.
Of course. So, it depends on how old you are, what your ovarian reserve is, because the majority of the cost of egg freezing will come from the medications. Typically, it is anywhere between $10,000 to about $15,000. $10,000 to $15,000. In some women, if low ovarian reserve, it may go up to $20,000, but mostly, I would say,
because
ballpark
you have to stimulate
is about
more
50,
times, right?
Not more times, but
hormones.
more hormones. Yes. So this is for one cycle of stimulation and freezing. It is ballpark around $15,000, which would include everything, the medications.
How about the maintenance of the eggs?
So that is variable. Different IVF labs have different. On an average, it's somewhere between $700 to $900 per year. So if you have some labs will be like it's $900 per year, but if you do a 3-year package, then it is $2,100 or something like that.
It's like storing your wine, right?
That's right.
Okay, I see. So if there's anything that you wish young women would know about egg freezing, what would you say there is? Because there are a lot of misconceptions out there. There are some people who told me egg freezing is for older women, which is, like you said, is actually the opposite.
That's right.
Is the case, you know?
So the most important thing is lifestyle. I am a big believer in lifestyle. I feel our bodies have immense healing powers, and we are just ill-treating our bodies. We are not supposed to be sitting for hours on the computer and just being a slave to the television. We were supposed to roam in the jungles, pluck fresh fruit and eat, or kill animal and freshly eat. That is how God designed us to be. And here we are in the last 100 years. We have just changed our life completely. So have a good lifestyle. Your body, for majority women, your body will respond to good food. So eat good food, fruits, vegetables, nuts, seeds. These are important. Try to sleep on time. Try to avoid smoking for sure, and excessive drinking. So while the occasional drink is okay, you can even have a glass of wine every day, for example, but that doesn't equate 5 glasses of beer or spirits.
I get it.
in one setting, because our body has limited ability to process these toxins.
I know.
So try to be kind to your body, and that will promote a good reproductive health on top of other health benefits, of course. So that is very important that we remember. And the second thing is that listen to your body. Your body is your body cannot talk, but your body is going to give you a lot of indications that it's not happy or something is wrong inside. If your periods are irregular, if your periods are painful, if sex is painful, if any of these things which previously were not there, don't just ignore and say, oh, it's okay. What if I'm using 5-6 pads every day? What if I need to use diapers to go to work? But I will just persist on. I will not see a doctor. So there is, in today's day and age, there is treatment and minimally invasive treatment for majority of female reproductive problems. So please come and see us so that we can find out if there is a problem, and if so, we can institute treatment. And in most cases for young women, if we catch it early enough, there's no surgery involved. It's usually medication and lifestyle measures. So we will tell you what to do so that this disease doesn't flare up and become a problem in the upcoming years.
Yeah. So do you think actually fertility is decreasing in young women these days?
Absolutely.
And do you think it has anything to do with diet and stress?
Absolutely. Absolutely. We are so stressed out. Reproduction is an additional task for the body, right? If you're already overworked and I say, no, you have to do this as well. You will say, no, this is not important. Priority is on my list of priorities. It's right at the bottom. I'm already so stressed with work and relationships or whatever else. I want to travel, whatever you want to do. There are so many things that the body needs to do. And then only if it is able to cope with these things, then it'll say, yeah, okay, I have extra money. So it's like an extra expense. If you don't have the means, you won't go and buy the Chanel bag, right? So you need to tell your body, look, if you want to have a baby, you need to tell your body, I am giving you all the resources to help you save enough for that Chanel bag. Because having a baby is like a Chanel bag.
Yes, that's true. Well, it's been so illuminating and insightful. And I think, you know, this really helps women sort of have it all. They have to work, and if they want a baby, now Dr. Anu is here to help you with the egg freezing. So then, you know, maybe your dreams can still come true of being both a mother and a superwoman.
Of course. We all are superwomen. We can do it all, just not at the same time.
With some planning.
So space it out. At some point, you focus on your career, but plan for the time when you want to have a baby. Because your fertility clock, unfortunately, is ticking,
it's really planning for the future. It's like buying the insurance, but you've got to do it young. Yeah, you can't do it when you're older.
That's right.
Well, thank you so much.
Thank you very much for having me. Thank you.
Really insightful. Thank you for tuning to this episode of Fertility Unfiltered. I hope you found our discussion with Dr. Anupriya Agarwal enlightening and empowering. Remember, whether you're considering egg freezing, IVF, or just curious about your reproductive health, it's important to seek expert advice and make informed decisions. If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your friends. Your support helps us bring more expert insights and candid conversations to you. Stay tuned for our next episode, where we continue to break down barriers and bring clarity to all your health and wellness questions. Until then, stay curious, stay informed, and take care.